The frustration of a failed IVF cycle. There's no question that failing an IVF cycle can be frustrating, not just for the patient, for the doctor as well. We want all our patients to get pregnant in the first cycle. That's great. We love happy patients. We love seeing their babies. We love looking at their photographs and eating their birthday cakes. And obviously, these happy patients will send even more patients to us. So in a perfect world, our success rate would be 100% and every patient would get a baby every time they did a cycle, and then you wouldn't be needing to watch this video. But you do, because the success rate is not 100%. And if you want to find out how you can reduce the frustration of a failed IVF cycle, please watch the end of this video. I'm Dr. Malpani. I'm an IVF specialist. Our website is at www.drmalpani.com. So why do IVF cycles fail? Now, basically, that would fall into three groups. One is where there is a biological problem with the patient. Now, you could be old as a result of which your egg quality is not great, or there could be other reasons. For example, your uterus could be distorted because of intrauterine adhesions. And it just means that you're a difficult patient. And that's fine. We're used to dealing with difficult patients. The second reason IVF cycles fail is because the doctor doesn't do a very good job with treating you. And I think that's important, and that can cause a lot of heartburn and frustration. And there is, of course, a third reason for IVF cycle failure, where everything's done perfectly. You're a good responder, perfect embryos, the doctor's done a good job, and yet your cycle fails. That's called the unexplained IVF failure category. And let's look at all these three one by one. If you have a poor chance of getting pregnant in an IVF cycle, and patients will and do, a good doctor will share this information upfront with you. He will prepare you for the fact that the cycle may fail. He will counsel you and educate you so that at least you have realistic expectations. So that cycle works, perfect. Even if it doesn't work, you're not shattered. You haven't gone to pieces because the doctor already counseled and explained to you that the odds were stacked against you, but you're going to do your best no matter what. And of course, doctors aren't fortune tellers, and sometimes we think perfect cycles which are definitely going to result in a baby fail. But the flip side is also true. We think patients with poor prognosis, with poor chance of getting pregnant, do pleasantly surprise us and do get pregnant. And that's the happy ending, of course. And biology is unpredictable, and we all know that. So much for that group of IVF failure patients who will often have recurrent implantation failure, recurrent IVF failure, because of their own intrinsic biological problems, which are hard to deal with. Some of these patients will then require things like donor eggs or donor embryos or surrogacy, which is a completely different set of issues. It's just that the doctor needs to be transparent and share this information with you before starting the IVF cycle. The second group of patients are the ones where the treatment was perfect and they still fail. That's unexplained IVF failure, and that again causes heartburn, but really, life is not perfect, biology is unpredictable, the future is uncertain, and no matter how good the doctor, no matter how perfect your blastocyst, we still can't predict whether the blastocyst will become a baby or not, and that's something you need to learn to live with. But at least if you have embryo photographs, you've seen that these are top quality blastocysts, you've seen your endometrium was trilamina, at least that way you know that the doctor did a good job, and that way at least you have peace of mind that you did your best. And even if the first cycle failed, it's just a question of being patient and persistent. Hopefully the second cycle will work or the third cycle will work. However, there is a huge group of patients who fail IVF cycles because the doctor provided them with poor quality care. This is a huge tragedy, because if these patients had gone to a better IVF clinic and had received better quality IVF care, they would have got pregnant. Now, the tragedy is often these patients are not sure what the reason for the IVF failure is. These bad IVF doctors are not transparent. They will not share information. They'll either blame the patient for the failure or blame something else, or give all kinds of excuses and pretexts and hide information, not share embryo photos, say something completely different after the IVF cycle fails. So before the cycle, they say, oh wow, you're doing well, great follicular response, lots of eggs, good quality embryos. And then when the cycle fails, they sing a completely different tune and say, oh yeah, you didn't get pregnant because the embryos weren't very good and the eggs weren't very good. So next time we'll do a donor egg cycle and of course charge you even more. Terrible advice. Now, which category do you fall in? Hard for me to predict, but it's something which you should know. And that's why you need to be a well-informed patient. And one way of reducing the frustration of IVF failure is arming yourself with information therapy. So A, you understand what your chances of success are. You understand whether you're good prognosis or not. You understand that IVF can take time because you've done enough homework to understand some of the uncertainty and unpredictability involved with any biological system, whether it's IVF or anything else. And you've done enough homework to understand that your doctor is providing you with the right quality medical care. And I think this is really important. The tragedy is sometimes patients just sign up with the first IVF clinic they go to. Either they see an ad or they go to the nearest one or the cheapest one or whatever else. And then after that IVF cycle fails, then the tube light starts working, and then they do their homework, and then they find out that the reason the cycle failed is because the doctor provided such poor quality care. By which time the harm and the damage has been done, the cycle has failed. Not only do they have to live with the consequence of the failure, there is also that heartburn and aggravation that the doctor cheated them and wasn't honest and wasn't transparent. Please don't let that happen to you. I can't predict whether your cycle will work or not, but at least make sure you get the best quality medical care, because this is in your hands and the doctor's hands. And the best way to do this is using information therapy to find the best possible IVF doctor. Someone who will be open, transparent, share information with you, and treat you like the intelligent patient which you are. We have tons of information written specifically for patients by me. We believe in information therapy. Our website is www.drmalpani.com. Tons of videos, lots of information. And if you have still more questions, we have a free second opinion form on our website. Please email it to me and I'll be happy to reply. We look forward to helping you to have a baby. And as an IVF specialist, nothing will give me more joy and happiness than helping you to start your family. See you.